why are we here tonight? Let's get right to the point. We are in what we could call a perfect storm. According to multiple studies, pregnant women with COVID-19 may be at increased risk of adverse pregnancy and birth outcomes, such as preeclampsia, preterm birth, and low birth weight. Numbers are rising. Just today, we have 624 new infections reported in the state of Maine, one of the highest numbers since January. Vaccine rates are plateauing, with many people still not vaccinated here in the state of Maine. COVID-19 vaccine recommendations have not always been clear for pregnant women, and mis and disinformation are just as infectious and transmissible as the Delta variant. But we have good news. There's stronger data and evidence for prevention strategies and vaccine recommendations. And we have great news. We have 3 people here this evening as part of our panel to help us make sense of it all, to provide evidence-informed information, their experiences, and wise words of wisdom. Our forum speakers include Dr. Olamide Shobowale, Holly McLaughlin, and Linda Robinson, certified nurse midwife. How we're going to run things this evening, we're going to do opening remarks from each of our panelists. We are going to go into questions that were pre-submitted before today's event. We're going to open to live audience questions, and then we'll close with remarks from each of the speakers. So without further ado, we'll go ahead and start with opening remarks. So please, first, Dr. Olamide Shobowale, could you please start with the takeaway messages that you hope that people walk away with today?
Thanks, Jennifer. So good evening, everybody. I'm Olamide Shobowale, and I'm an obstetrician gynecologist at Eastern Maine Medical Center in the Northern Light Health System. I'm excited to be here today because I think this is really a perfect time to have a forum like this so that we can talk about all the concerns that people are having regarding women's health, really, and the COVID-19 vaccine, as well as your concerns regarding vaccinations for, your newborns and your little children at home. So I'm hoping that by the end of this forum, you're really able to get that the COVID-19 vaccine is not more dangerous than actually getting a COVID-19 infection. And the risks that are attributed to that infection are much higher than the COVID-19 vaccine itself. I hope that you're able to get the evidence that we've been just collecting over the past year regarding COVID-19, and as it relates to pregnancy, as it relates to fertility, as it relates to you and your families, you and your new families. And hopefully that will assuage some of your concerns, some of your fears regarding getting a vaccine if you are currently pregnant or hoping to be pregnant in the near future. So I will turn it over to the next person, but I'm happy to be here. Thank you, Jennifer.
Great. Thank you for taking time and joining us this evening. Next, we have Holly. Holly, would you please provide your opening remarks?
Sure, and I have my children with me, so I apologize if it gets a little loud over here. Hi, I'm Holly McLaughlin. I'm one of the co-owners of Chickadee Infant and Toddler Care located in South Portland. My master's degree is in education, and I've been a teacher for public schools for 15 years. And prior to that, I worked in childcare centers while I was in college. So I left the public school system this summer to open Chickadee. Amy Crowley, who is my business partner, and I felt very strongly that we had the opportunity to do the right thing and be a positive example for our childcare community. For us, the biggest thing is our babies and young children, they don't have a choice to be vaccinated, but we do as adults. So it was up to us to put them first and protect them. And we do this by using the cocooning strategy. So a cocoon vaccination strategy refers to when people in the immediate environment of children are inoculated against certain diseases so that the baby or the child may not develop that illness. So in addition to requiring the vaccine of our employees, we also ask for our employees to wear masks while they're in the building, because we know that the Delta variant is transmissible even with a vaccine. And you may not know that you are hosting the virus if you have the vaccine, and you can give that to your children. So we try to do everything in our power to keep kids safe. And for me, like, nothing says I love you like I'm going to do everything in my power to protect you. And that's just where Amy and I are coming from as business owners who work very closely with children. And finally, there were some people who, when we were interviewing, they were not vaccinated. And 4 out of 5 people that we wanted to employ ended up getting the vaccine because we asked them what was important to them. It wasn't, not everybody was ready for this, but they felt that it was the right thing to do. And so that's our story. That's why we did what we're doing.
Wonderful. Thank you, Holly. And having your children make a guest appearance reminds us why we are here tonight. So thank you for their participation in the panel as well. And last, we have Linda Robinson, certified nurse with Midwife.
Hi, thank you for having me, and thanks for doing this. I have worked in Bar Harbor, Maine. I was in a practice here for 23 years, caring for women, and in a small rural hospital with, without a tertiary care, without high-risk services. So in this setting for pregnancy, what I felt was, such good quality care was having time to spend with women, offering preventative services so that we could prevent problems from happening, and identifying any problems before they became serious and referring them in a timely manner to a place that could accurately and competently care for their condition. So much of Maine is rural, and the problem that I see in health, and one of the problems in women's healthcare in the state, is that so many small rural hospitals are closing their maternity wards, and women are having more difficult time accessing care. One of the things I want to make very clear in my takeaways from this is that I want women to know that they deserve reasonable access to safe care, competent care, and culturally sensitive care. And they deserve to have accurate information. They need to have their questions answered. Pregnancy is a scary time when everything's going well. Okay, we're in a really difficult, unique, scary, once in a lifetime situation here. And I understand how there can be lots of concerns and questions about this. You need to trust the provider that you're going to, and believe that you're getting accurate information from them. You deserve this. This is one of the basic rights for pregnant women. I have worked overseas in many different settings, and the other thing I want to talk about is how passionately I believe in vaccine. I was not a healthcare provider that encouraged lots of testing and invasive procedures. I really believe in holistic care without a lot of unnecessary intervention. However, when it's needed, it should be accessible and available. Vaccines are one of the things in medicine that works with really minimal invasive intervention. I worked in countries where I saw kids die of measles. I mean, a completely preventable disease. And I feel like, part of our privilege here up until now is that because we had access to healthcare and clean water and food, those communicable diseases weren't seen as life-threatening. But now we're getting a real reality shock of what a communicable disease can do to a community. And we have a safe vaccine. And granted, new information is coming out every day, and that can be confusing and scary too. But I feel like we have an obligation as healthcare providers to be honest, to admit when we don't know, what the future is going to be, but to give you the most accurate and, up-to-date information that we ourselves have. But I really believe in vaccine. And, when I look at like viruses like rubella, that, we do not have children with gross malformations and birth defects now because we have a safe vaccine for that. So there is just years and years and years of experience with vaccine. And even though this one is, yes, new because the disease is new, there's a lot of information we do have about how it works. So I'll leave it at that and just wait for questions. Okay.
Great. Thank you for these really powerful and wonderful opening remarks to get us started tonight. So I'm going to start with some of the questions that were submitted prior to tonight's event, whether some people are joining us today or may not have been able to join us. And we're going to start off a little bit around the science and kind of talk right away about safety and vaccine and to provide that reassurance. So actually, I'm going to start with the question, how do we know it is safe if there haven't been any long-term studies on the COVID-19 vaccine? And I'm going to go ahead and pump that one right to start off right now with Dr. Shobowale.
Thanks. Okay. So I think that's basically the number one question that I get in my office from all of my patients, pregnant patients, or people who are, infertility patients and trying to IVF and things like that. One thing I want to say regarding the COVID-19 vaccine and how new it is, or in quotes new, is that the technology that the COVID-19 vaccine uses, which is that mRNA technology, which I'm sure lots of people have heard about, is actually not new. We've had it since 1989. The only reason it wasn't applied to vaccines is because it's so hard to store, which is one of the biggest reasons why it was so hard to amplify and distribute to all the different countries around the world, because you have to store it in very specific conditions. Otherwise, it breaks down very quickly. It's a very, as I would say, like a fickle protein in that it's not very hardy. So it doesn't just stay alive very easily. So I want people to know that even though the COVID-19 vaccine itself is new, the actual mechanism that the vaccine uses to give you the antibodies, to give you the protection, is 30 years old. So it's not new at all. It's just being applied to a new virus, to a new disease, okay? They were actually trying to use it for the Ebola vaccine, which was 5-6 years ago when we got that little scare from the Ebola virus. So I want people to be comfortable knowing that there's no long-term data on specifically the COVID-19 vaccine, but how it works, we have tons and tons of information on that. And it's not something that's going to change your DNA. It's not something that you have to worry about for like fertility reasons. And I think one of the biggest things with long-term data, and truthfully, we don't have long-term data. We have maybe a year and a half on it. And I'm not gonna sit here and say we have all the information that we'd want. We don't. But pregnant patients in particular, patients or reproductive complications as it relates to females is usually not something we study. Up until probably, I don't know specifically how many years ago, but up until recently, pregnant patients were considered basically people who are vulnerable, a vulnerable population, just like children. So those are the two populations which most people are the most concerned about, but we don't do trials in it because you usually don't offer yourself up to try a new medication to see what the effects could possibly be. So a lot of our data that we get is usually by the way. So for example, if you look at Tylenol, I will tell people to take Tylenol all the time while they're pregnant. There's no specific trial that was done with Tylenol in pregnant patients. It's that when people were pregnant, they took Tylenol. They reported it saying, they told it, Tylenol, acetaminophen companies that, oh, I took it when I was pregnant. We collect that data after the medication has already been out for years and years. And then we say, actually, it's fine. Or actually, it's not fine. But in order for a medication to even get to a point where they can, put it out to the general public that anybody can use, we actually do test it in animals that are pregnant, and we test certain things that we wouldn't test in necessarily humans in the animal population that are very similar to how we would react. And that's how these medications get beyond a certain point. So if already we know in an animal population it's causing infertility, it's causing malformations in or birth defects for those animals, then we already know that there's going to be some kind of, black box warning on the medication to say, if you are pregnant or possibly pregnant or, anything like that, you definitely don't want to use this medication. I want to point to there's one of the largest studies that we've done on birth defects. It's by the National Birth Defects Prevention Study. It was done from 1997 to 2011. That enrolled approximately, I would say I think it's just under 44,000 patients. And it's basically provided the base outline for a lot of medications, chemicals, all these different things as to what the abnormalities can occur when you take these medications or you take these, or you're around certain chemicals in certain environments, so chemical warehouses and facilities and things like that. One of the things that is in there, which I wanted to highlight, was that they did a study that was talking about fevers in pregnancy, which some people are concerned about. Long-term data, you get a fever when you're pregnant, you get a fever when you get the COVID-19 vaccine, that's going to hurt my baby, because there is data to say that that could cause an abnormality. Yes, that is true. And in this study particularly, they did say, fevers associated with urinary tract infections, fevers associated with sexually transmitted infections or pelvic inflammatory disease.
I think she's experiencing a little bit of a delay in her internet. So we'll make sure that we come back to that question being answered. But I'm going to kind of transition that response. Oh, we just lost you for one moment.
Oh, okay.
the phrase froze a little bit, but you were talking about fevers.
Yes, fevers. So I just wanted to say that they found fevers related to urinary tract infections and pelvic inflammatory disease to possibly cause more abnormalities than fevers related to respiratory diseases. So that's from data from almost 10 years ago. The data that we have for the COVID-19 vaccine, a lot of it is coming from people who are self-reporting. So for example, I have colleagues who were breastfeeding when they got the vaccine at work. And so they self-submitted their breast milk from before they got the vaccine, after they got the vaccine at different points, different weeks and things like that. And that's going into a big CDC database. It's like the Vaccine Safety Data Link, the Clinical Immunization Safety Assessment Project, and the Vaccine Adverse Event Reporting System. And they're being able to pull all this data from numerous people around the country, numerous backgrounds, ethnicities, ages, all these different things to say, okay, this is what we're finding now. And that's where we're getting a lot of our safety information from. So we don't have long-term data, but the data we have is actually quite good for the fact that it's in pregnant people. We usually don't get information for pregnant patients or fertility issues for a long time, for like years and years. So this is actually pretty good for what we have and showing very promising and positive things for the vaccine.
Thank you. Linda, you wanted to add to that?
I just want to add to that with anything in pregnancy, and we spend so much time telling pregnant women that you shouldn't smoke, you shouldn't use alcohol, you shouldn't do anything that's not like healthy, and that you don't understand. So I understand the whole reluctance and fear around this. However, what we have to do with any kind of decision making in pregnancy is weigh the risks and benefits. Okay, and so what we know and what we don't know. Okay, yes, we don't have information about long-term effects of this vaccine. We don't have that because it hasn't been out that long. Okay, that's a given. What we do know is that the women who have gotten COVID while pregnant are experiencing complications. So we do have that information. That is something that we do know. And we do know that the vaccine can prevent the disease. So this is what we're putting together now. I mean, would everybody love to have like a lot more information before we, put it out there and educate women? Yes. but that's not possible right now. But we do know that getting COVID-19 while you are pregnant poses great risk to both the woman and the fetus. That's a known. And it is known that the vaccine prevents this disease. So those two things, I just wanted to kind of put that out there.
Thank you. Those are two great responses. And I would just add, as we talk about data collection around pregnancy, the federal CDC has a program called V-Safe. And that is for any woman who is watching who is pregnant and has been vaccinated. It is a program that you can sign up for. That it comes down as an app, and the CDC will just occasionally do check-ins after your vaccination. And that's another way that they're collecting data that pregnant women can actively participate at their choice to be able to continue that data collection. So you can actually, participate and be part of that information gathering. So I'm going to kind of twist this a little bit. And so we just heard a lot of scientific medical information. Holly, how do you answer parents' questions with all this scientific medical information that's out there? I'm sure that parents are coming to you and asking questions.
Yeah. And, and I'm not a medical professional, so I just be as transparent and honest as I can be in whatever moment we're having. So parents, they've asked, well, what are you doing for protocols to protect the children? So we always say, the first thing we say is everybody's required to have a vaccination, whether they work for us or they volunteer for us. The second thing is everybody is required to mask. And the third is we have cleaning protocols, just like all the daycares do. Everybody has a COVID handbook now. We have a COVID handbook that displays our cleaning procedures and how we do that, and how we make sure that children wash their hands as often as possible, and when adults wash their hands, which is when they enter the building, before they handle food, and just disinfecting toys throughout the day. So there's a lot that we do to try to keep everybody safe in general, and it's also good for trying our best to keep COVID out of our daycare. But, we also say to parents along those lines, it can happen where somebody tests positive for COVID in our center. And if that were to happen, we would follow the CDC guidance. We would most likely close down the center for however long we need to. We have 5 different classrooms. But the way that our building is designed, you have to access 2 of them through 1 room. We're housed in an old elementary school that's been converted. So I don't know what it would look like if we had to close. I know that there was a childcare center that closed this week nearby where we are because of COVID and RSV. So, it is in our community and it is happening. And so we take that very seriously. We need to provide parents relief so that they can focus on their work. We see that loud and clear from the last year and a half of living in a pandemic. Parents, it's not healthy or possible to work while your children are with you. My kids are just very well behaved, which is why I knew I could do this with them. But yeah, I think just being honest and transparent and knowing that it's okay to say, I don't know, when parents ask you questions. We're in the great unknown right now, and there's so much that we're learning. I hope that answers the question.
Great, thank you, Holly. So Holly, just sticking with you, one of the questions that we have is that someone is just opening a home daycare. And they're asking, can I require families joining our program to be vaccinated? And maybe not can I require, but like, what was the process that you've gone through? Like, who is required in your entity? You've talked about the workers. What about families? And sort of, how do you go about doing that?
Yeah, so, it's been really interesting for me. So I haven't asked parents about disclosing their vaccine status And that's not intentional. I just didn't think to ask them throughout this entire process. But so many parents come to us because we require the vaccine that I feel we are attracting the group who wants their children in a facility where they know everybody is vaccinated, no question. So these are the parents who are coming to us, and when we ask parents who want to be parent volunteers, can you please disclose your vaccination status? 100% of the time thus far, they have been fully vaccinated. As far as opening an in-home daycare, I think that it's your right to ask parents, and just let them know you're asking. Again, transparency, you're asking for the health of everybody in your home. It's your home. And I think that you definitely have the right to ask that. And I think that it's, for me personally, if I were opening an in-home daycare, that's what I would do. Because I'm bringing so many different children together in my own house from all over. So yeah, I think that ethically that's the right thing to do. Yeah.
Great, thank you, Holly. So interesting question here. And Linda, maybe you can start to answer it, because this is kind of a question that could probably relate to many different vaccines, is if COVID vaccine isn't recommended for babies outside of the womb, why is it recommended for babies inside the womb?
Yes, I can see how that would create a lot of confusion. I'll start, but I think Dr. Sobowale, you can pick up on this. Newborns' immune systems are not fully developed, okay? And there are risks still of them becoming infected with, different pathogens. In pregnancy, if a woman is immunized, she can pass some of those antibodies on to her newborn, okay, to the fetus and to the newborn. And the newborn will have some immunity for the first couple of months. I mean, one example of that is whooping cough, which is now given to, that is a vaccine that is given to everyone or recommended for everyone in pregnancy. Whooping cough can be fatal to a newborn before 2 months of age. I mean, it is a terrible disease. And if a woman gets immunized in pregnancy, it can protect her newborn for a couple of months. Okay, so there have not been enough studies done, or I'm not quite sure what the studies are being done now on doses for children. I know they're being done, but I'm not sure how far along they are for the COVID vaccine, or when it's going to be, when they will determine that it's safe to be offered. But if we're going with historically how vaccines work in pregnant women, I mean, it may, I don't know if there's any studies done on this, but it may offer some protection to newborns if a woman gets vaccinated in pregnancy, even though it is not going to be recommended for children until there's many more studies done to determine doses and safety at what age. I mean, do you want to add to that, Dr. Sobowale?
Yeah, sure. No, I think you've hit it right on the nose. So the immunity is one of the biggest things that you are concerned about when you're trying to vaccinate children. So for example, the flu vaccine, we recommend that for all of our pregnant patients in flu season, which is actually starting in the next week. So the flu shot will become available in the next week up until around, I think it's March, April is when they kind of say flu season's over. So we give the flu vaccine to babies when they're 6 months old, and they can't get it prior to that. The flu vaccine, they have done studies where they gave it to babies who are 3, 4, 5 months old to hopefully give them a little bit more immunity earlier on. And they found that the response to the vaccine just wasn't robust enough, not until they got to around 6 months. And that's why we give the flu vaccine at 6 months. So it's not that the flu vaccine is unsafe for the baby at under 6 months, it's that they just don't generate that immune response that we need them to generate to protect themselves. But when they're within the womb, when you're still pregnant, you can give those pre-made antibodies to the baby to protect them for a few months, like Linda said, before they're eligible or able to get the vaccine. Linda actually touched on another point, which I think people usually have questions on too, which is when it may be eligible for children under 12. And currently, Pfizer and Moderna actually are doing trials for as young as 6 months old up until 11 years old. And they have different doses that they're testing. They have different ages they're testing, different backgrounds, all these different things. And I think what I read recently is that the Pfizer trial actually has determined that a third of the dose currently is what's good for a certain age range, 5 to 11. And they're working on, a little bit younger. So we don't think it'll probably be out until the end or early next year for that age group, if it gets the emergency approval through the FDA, but they are working on that. And that's kind of remarkable because these vaccines, to have trials in the pediatric or the kids population doesn't usually happen for a long time. So they're really trying to move this forward as much as possible so that the biggest unvaccinated group, as we know right now, are our children. So if our children can get vaccinated, we can even decrease that pool of people who aren't vaccinated.
I wanted to just clarify that to my knowledge, the COVID vaccine is not being recommended in pregnancy in order to protect the newborn. Okay, because I don't think that has been determined yet. It is being recommended in pregnancy to protect the mother and the complications that are being wrought from the infection while women are pregnant, which are dire.
So actually, it's not necessarily to protect the newborn, but to give the newborn, almost like I tell people, the analogy I give people is if it's raining outside, you put on a rain jacket. You put the hood up or you use an umbrella. The COVID vaccine is the umbrella or the rain jacket. You will still get wet possibly, but you won't look like the person who's walking down the street in only their clothes. They are going to get very, very wet. They're going to get soaked, but you are not going to be as wet. You're going to stay dry. That is what the COVID vaccine is doing. So the antibodies that are sent to the baby will protect them. And an example of this, the only example I can give is a personal example. I got the COVID vaccine very early on because I'm an obstetrician. I work in the hospital, and that was something that they were recommending, and I felt strongly enough to get it. And I was breastfeeding at that time, my daughter, and I kept breastfeeding in order to possibly pass on some of those antibodies. This was back in December of last year. This is way before we knew if anything was even being transmitted. About March, my son and daughter both got exposed to COVID. My son tested positive for COVID. My daughter did not test positive. They both got exposed. They live in the same house. They share the same food. They, play with each other. There was no quarantining from each other. They're 2 and 4. So, I expected her to test positive. She didn't. I didn't. My husband didn't. A month later, she got exposed again by the same process. She got exposed again. We tested her. She still didn't test positive. There's no reason why my son, who wasn't being breastfed and, had no protection possibly from anywhere, would test positive, and my daughter shouldn't test positive if that vaccine that I got and that she is still breastfeeding didn't protect her. So that's one of the examples I give people because it's the most personal example I can give, because I was petrified that they were going to get very sick from it. My son didn't have as bad of an reaction to it, but she didn't get anything at all, never tested positive. And I tested her a few times and she still didn't test positive. So I do want to say that it does confer some protection to infants.
Wonderful, thank you. We've had a number of questions come in, both pre-submitted and live, about the hard data about COVID and pregnancy and COVID vaccine and pregnancy. So can you talk a little bit about, nobody here is a researcher around this area, but maybe you can talk a little bit about the data that you look at or the data that you refer to. And so maybe we can start with you, Dr. Shibawale.
Sure. So I guess I'll start on the fertility one. We've talked a lot about pregnancy, and I think most people know about that one. So the fertility concerns are people saying, there's no long-term data to prove that this won't affect my fertility later on, whether it's male or female. So what happened is actually in May of this year, they did a study from January to May, done in the US. They took samples of people who were about to have frozen embryo transfers, and they determined whether they had any COVID-19 antibodies in those samples that they did. There are about, I think, 143 transfers that they were analyzing. 38% of the patients had COVID antibodies because they had COVID. and then the rest, 65%, had antibodies because they had the vaccine. So, 35 and 65. So then they did the transfers, and what they found was that there was no difference in the ability of someone to stay pregnant or get pregnant if they had antibodies to COVID from the vaccine or they had antibodies to COVID from the infection. So I'm not promoting getting COVID, but I'm saying that if you get COVID or if you have the vaccine that gives you the antibodies to it, you can still get pregnant. You will get pregnant. There are lots of people who have had the vaccine and been able to get pregnant. The way the vaccine works, it can't make you sterile. There's no actual way for it to make you sterile because it doesn't get very far in your body to do that. The effects of it, they've studied, they studied that for the frozen embryo transfers and the pregnancies, and they said no issues with those people. They did it also with semen to see if there was any changes in semen analysis because it takes 2 to get pregnant. And so they enrolled some men in between December and January, and it was a small study, but they still showed no change in semen and sperm parameters too. And this was a range of 18-year-olds to 50-year-old men, okay? With breastfeeding, it was in the Journal of American Medical Association. They showed antibodies in the breast milk from 2 weeks after the first vaccine dose to a maximum of about 4 weeks is when the maximum kind of effect was felt for the Pfizer vaccine, and it nadir'd so it plateaued at about 6 weeks. For the Moderna vaccine, it was more robust after the second vaccine, but they were able to get samples and show that these antibodies were there in the breast milk and also were there, so they know that it was being transmitted. And the biggest thing with breast milk, and I want to just help people understand, when you get the COVID vaccine, the baby doesn't get the COVID vaccine. Nobody but you gets the COVID vaccine. You act as the gatekeeper to your infant. So when someone says that, okay, you have the flu, your baby will likely still do better than you would because your baby is being protected by your maternal body. Your baby is getting everything filtered out by you. So only the good stuff is what the baby's getting, hopefully. That's what we're hoping. But the effects of you being sick is what compromises the baby. And that's why people have preterm deliveries or miscarriages or things like that. If the baby was by itself, a 2-month-old baby and gets the flu versus you getting the flu when you're pregnant, that baby will have much more serious complications than for you because you protect that baby. So when you're breastfeeding, you're giving that baby, you're not giving the baby the vaccine, you're giving the baby the protection they need. And it's stuff that actually goes into their mouth. It coats basically the lining of your GI tract. It doesn't actually get absorbed into their blood, but that's almost thought of as like your first pass, or what we call the first barrier for any infection to go in. And when it coats all those areas, it hopefully decreases the possibility of COVID actually getting absorbed, the possibility of COVID actually having any effect. Your skin is the first barrier to infection. That's kind of what happens in your mouth with all these antibodies when they get it in the breast milk. So those are the 2 big studies that have happened in the past 4 or 5 months, but there are numerous studies that are coming out day by day. There's people in Massachusetts who are like, we're just going to look at this data for breastfeeding. We're going to look at the data for, are you able to get pregnant? And that's where they found the data when they compared COVID positive patients in pregnancy, what happened versus people who got COVID and maybe are vaccinated. And the difference is that they didn't get as sick, like Linda mentioned earlier. They didn't have the miscarriage rate. They didn't have the preterm delivery rate, and they didn't have the growth restriction rate of the people who had COVID.
Wonderful. Thank you. I think one of the take-home messages that I'm getting from just understanding data, whether it's about the effects of the vaccine or the effects of COVID infection on pregnant people, is that there's multiple data sources. There's studies that are done where they take groups of people and either follow them or see where they're at, or there's active data collection processes like the VAERS, the Adverse Event Reporting System, or the vSafe, or other active data collection systems that are collecting data on an ongoing basis from pregnant people. But I think this brings up another point, and going back to Holly, something that you said around cocooning and knowing that our children can, under 12 can't get vaccinated right now. That then brings up the issue of masks with daycare. So we do have a question around Is it safe to be sending my child to daycare where kids aren't wearing masks right now? So I know that you can't really talk about efficacy and safety and provide the numbers on safety, but how are you handling masks right now in your daycare? And what would be some recommendations or lessons learned for other providers and parents who are sending their children to centers?
I would definitely say that there is always a risk involved sending your child to daycare when they are too young to wear a mask. There is a risk involved in sending your child to school and daycare when they are old enough to wear a mask. We really have to look at the adults in the room and the competency of the adults in the room to clean and care for the children while they are there, ensuring that the environment is as safe as it can be. And even then, I cannot say with 99% assurance that it will still be safe. This specific virus is just so new to us, and we still have so many in our community who are not inoculated against it, that we are just, it's pervasive. We're seeing it, and we are seeing it in daycares. And I hope that with the children in my care, I hope not to see that, but it is a risk. So you do have to, if you are considering sending your child to daycare, you have to be okay knowing that there is a risk, even with people who have the best intentions and who are doing everything they can to protect you and your child foremost. So I wish I had better news, but we're doing the best we can, and there's no guarantees, unfortunately.
Great. Thank you, Holly. That's really helpful. Linda, just with your background in working within a practice, we had this one question come in, and the person says, I work in a hospital. They're going to fire employees who will not get vaccinated, in particular pregnant employees. Should there be any flexibility for pregnant women or one who has received first dose of vaccine and are on the fence about getting their second shot, Moderna to be specific? So the question around the healthcare mandates, how to work with that in terms of should there be flexibility for pregnant women? So what are your thoughts on that question?
I know this is difficult, but healthcare workers, especially in a hospital, not necessarily in an office where people are just coming for preventative care, but especially in an office. I mean, especially in the hospital, people are compromised. And if they're in the hospital, they have obviously a health problem. And I feel like unvaccinated healthcare workers are then endangering the people that they're caring for by potentially passing the virus on to them. It's difficult, and I understand, that people feel like they have, a right to refuse, but when you're looking at, the public, like, to me, it's almost it's a humanity issue almost that we're talking about right now. I mean, no one wants to mandate that people behave in any particular way, but this is a crisis, and it's a public health crisis, and the only way we are going to get through it is by vaccination. I mean, I think that it is been clearly demonstrated that the vaccines work, and also so do mandates. I mean, mandates work to increase the vaccination rates. So I understand why those mandates are being employed if people are hesitant to get vaccinated. I get it. I mean, I get it. You're putting people at risk, and it's for the common good. I mean, everybody wishes we could have more information and more, more long-term studies. But the fact is, we know that this works. We know it prevents the disease. We know what this disease can do. We are watching people suffer and die from it. And, the idea of herd immunity, waiting for herd immunity, if you want to go that route, you have to be willing to watch half the population die, or be crippled from it. So, I actually support that. I support mandating vaccinations for people that work in the healthcare industry. I do, and schools.
Thank you. And I think the point in the question as well is that there was a question on flexibility for pregnancy, but as we know, there aren't, as we've just discussed here, there aren't any long-term adverse effects that are different for pregnant women.
No,
So
and
you're
you're at more risk when you're pregnant. That's what's being demonstrated now, that, for pregnant women, they are at high risk for complications in their pregnancy.
Yeah.
And yeah.
And one thing I wanted to add was that, just like you said, if you work in healthcare, you're actually around a lot of people who aren't very well and who are sick because that's why they came to the hospital, as they needed help. So you're a high risk worker in itself because you're exposed to a lot of different diseases, a lot of different viruses. So apart from protecting the people around you, you have to protect yourself too. So as a pregnant person working in healthcare, you want to make sure that you've put on all the shields you possibly could so that you also don't get sick and take it home. Not everybody is going to have severe COVID, but like we say, if you get sick when you're pregnant, it's a lot worse than if you got sick when you're not pregnant. So this is one of the things that we're trying to say, this is going to protect you as well as everybody around you.
Mm-hmm.
Great. And actually, this will probably be one of the last questions. And just to kind of talk about what is the recommendation now that we have clarity from CDC and the Advisory Committee on Immunization Practices. So can you just reiterate for us, what is the recommendation for pregnant women by trimester and who are breastfeeding or thinking of getting pregnant? Could you just remind us again, or just be clear on what the recommendation is?
So the recommendation by the American College of Obstetrics and Gynecology, by the CDC, by WHO, all the basically big acronym groups, is that that everybody should get vaccinated. If you're pregnant, if you're trying to get pregnant, even the Reproductive Endocrinology and Infertility Society has stated that it is fine for you to get the COVID-19 vaccine, even if you're trying with IVF, even if you're trying assisted reproductive techniques. That won't stop you from getting IVF done. What will stop your IVF cycle, what will stop you from getting assisted reproductive technology is if you get COVID, because you will have to wait until another cycle. And that could delay it by a month, 2 months, depending on how bad your COVID is. So the recommendation is to get vaccinated. Trimesters, it doesn't matter which trimester. It's any trimester, because they've done a study recently that showed actually specifically before pregnancy and before 20 weeks, no difference for congenital abnormalities, in growth, in miscarriages, nothing like that. It didn't impact any of that. So it doesn't matter which trimester. They prefer you to get vaccinated as soon as you can. But if you wanted to wait, people are concerned that, okay, the baby's still forming. It doesn't impact anything there. There's no congenital that's ever been found with the vaccine. And I want people to know that the COVID is much worse than the vaccine.
Thank you. So with that, we're closing in on 7 o'clock. So just final sort of wise words of wisdom on the topic this evening. And Holly, I was wondering if we could start with you.
Well, for me, making the decision to have all of our employees vaccinated was an easy one. It was not a hard decision for us, because our job, our career is surrounded by the idea that babies and children come first and that their safety comes first. And for us, it was a very clear choice that because they can't receive the vaccine right now, but we have to be the ones who are protecting them. So that's what we did. And it's hard. It's really hard because not everybody wants it. But my personal wants are not as great as the need to protect our children. And I think I said this earlier, for me, like nothing says I love you, like I'm going to do everything in my power to protect you. And that's the lens that we're coming from with that decision. Thank you.
Thank you, Holly. Linda.
Yeah, I mean, I want to reiterate that that I feel strongly that women need to be listened to, their concerns need to be listened to, and you have every right for every concern that you have to be addressed by a knowledgeable, competent provider that you trust. So if you don't have access to that, that is not okay. Okay, you have that right, and I don't want anyone to feel like their questions aren't being answered or they feel like they're not being heard. That said, I do want to reiterate that I feel like I believe that this vaccine is safe with the numbers of people who have gotten the vaccine. I mean, it's just a unique situation where we can study so many people who have gotten this vaccine in so many different phases of their life. I mean, it's a really unique opportunity to study something like this that we don't usually have. So it's another reason why we can gather data so much more quickly, because the numbers are so high. I understand pregnant women's concern for their unborn child and completely support that and feel the same way. I devoted to the health of unborn children, but it is not healthy for children to grow up without a mother either. So, I mean, protecting yourself when you're pregnant is one of the most loving, caring things you can do for your child. So, yeah, I want to leave it at that.
Great, thank you, Linda. Dr. Shobawale.
Yes, so I think, like Linda said, if you have concerns still and you're still on the fence and you need somebody to navigate those concerns for you and to talk to you about the data or understand all the information out there, because there's a wealth of information out there for a lot of different topics, then you should reach out to somebody who can do that. You should reach out to, your OB or your primary care doctor or somebody you trust in the health field that can really explain that for you in a way that you'll understand and that will get you to the point that hopefully you'll feel comfortable to get the vaccine. But I just want to reiterate that COVID will most likely be like the flu, where it's around, but it doesn't affect us as much. But we need to protect ourselves as much as we can. And the vaccine is very, very safe. I initially was very, very hesitant about the vaccine. And I remember telling my husband, I was like, I don't know about this vaccine. And I literally, when the trial came out for the Pfizer and Moderna vaccines came out, I went and I read through like pages and pages and pages of data, because I understand that stuff, and that's what I needed to convince myself. So I read through all the different ages they tested it and all the different ethnicities, all these different complications. And I could come to the point where I said, this is pretty legitimate and this is pretty thorough. And so I felt more comfortable doing that. So if you need somebody to navigate you through that, then please ask. And I've talked to lots and lots of people about this, even in the past month, especially with the mandate in the past couple of weeks. I am happy to talk to anybody. This is not a negative thing of you're a terrible person if you don't get the vaccine. It's more of I need to support you because you're my patient and I really want you to do the best thing for you and your baby and your fertility in the future if you're not pregnant right now.
Thank you. Thank you to our panelists for providing information and perspective. In the state of Maine, we have about 13,000 births a year. And so I think the message that we're all saying here tonight, as panelists and why you're here today is because we want to make sure that every single one of those 13,000 births have the best possible start that they can, and that our pregnant people in Maine are also, at the healthiest, optimal health that they can be. So they're becoming parents and being able to take care of their children. So again, thank you to the panelists that were here tonight. Thank you for everyone who is joining us. Thank you for everyone who sponsored to make this event possible. And I think the biggest take-home message I think we heard from all our panelists is have your questions answered by your healthcare providers, by those trusted sources with good information. And hopefully tonight, some of those questions were answered. And if you have more questions, seek out that accurate information from people that you trust. Thank you.
Thank you.
Thank you for having us.